Welcome to everybody. So please mute yourself, but show your video picture. Sign in your name and your FB account in the chat box. Use the chat box to ask questions and make comments while the pep talk is on. So we just had a group picture. We'll have another group picture at the end of the talk show. So will be a reminder. Take the OLETE. OLETE stands for Online Learning Cum Evaluation Test Exercise and have a perfect score if you want to get the certificate. Okay. So again, good afternoon. I have a patient empowerment program in which I'd like to empower the lay people or patients to take control in the management of their health. In the light of the ever-confusing medical information and confusing health professionals, I'd like to equip them with a pep talk that will enable them to make educated, rational, and cost-effective decisions on their health concerns. This is the third pep talk. I formally launched the pep talk on May 15, 2021, with the title Safety Program Against COVID-19. The second pep talk was held in May 22, last week, with the title Home Management of COVID-19 Patients. What I have in mind in this series of 3 pep talks on COVID-19 is to ensure that nobody who attended my pep talk will die from COVID-19. I am targeting to help at least 30 persons. This is my key performance index. I'll be contented if I can save at least 30 persons who attended my pep talk from dying from COVID-19. I hope you will be in this group of 30. The title of my pep talk today will be Hospital Management of COVID-19 Patients. I'll just give you an overview. Later on, we'll have some speakers who will share their experiences. COVID-19 patients are those infected with COVID-19. They may be symptomatic or asymptomatic. For the symptomatic patients, they may be in the mild, moderate, severe, and critical stages. Management of COVID-19 patients may be done at home, at a designated quarantine or isolation facility, or at a hospital, depending on the stage and other situations. As a general rule, COVID-19 patients with moderate, severe, and critical diseases should be managed in a hospital setting. Asymptomatic, those without symptoms, and mild COVID-19 can be managed at home or at a designated quarantine or isolation facility. My pep talk will focus on hospital management of COVID-19 patients who are in the moderate, severe, critical stages. Last week, I talked about home management of COVID-19 patients. These are patients in the asymptomatic and mild stage. I will just give an overview of how patients are being managed in the hospital. The following are the indications for admission to a hospital for further management. COVID-19 patients with moderate severity of the disease, which include those symptomatic patients with non-severe pneumonia or those manifesting difficulty of breathing at home with a respiratory rate of still less than 30 per minute or with oxygen saturation of still more than 92%. In some cases, these moderate COVID-19 patients can be managed at home, but there must be a close monitoring by a physician through telemedicine. Another group of patients which will warrant admission to the hospital, these are COVID-19 patients with severe category of the disease. So this includes symptomatic patients with severe pneumonia or those manifesting difficulty of breathing at home, this time with a respiratory rate of more than 30 per minute and with an oxygen saturation of less than 92%. Third group of patients warranting admission to a hospital, COVID-19 patients with critical severity of the disease, those manifesting respiratory failure, septic shock, and or multiple organ dysfunctions. COVID-19 patients with mild severity, but with concomitant uncontrolled chronic medical diseases, such as diabetes, hypertension, heart diseases, bronchial asthma, is also an indication for admission to a hospital. In the hospital, differentiating it from the home care management, the COVID-19 patients admitted are given the following: more intensive respiratory support, such as high flow oxygen and intubation with mechanical ventilation as indicated, more intensive medications for both COVID-19 infection and existing medical diseases, and more intensive monitoring of symptoms and vital signs with a lot of diagnostic tests such as CT scan and inflammatory markers. At present, there are different, therefore, no universal or uniform protocols in managing COVID-19 patients in hospitals, not only in the Philippines, but also abroad. In the end, the specific management for a particular patient will be dependent on the following: the mindset of the attending physicians, the government's approval of emergency use authorization of drugs against COVID-19, severity of the COVID-19 infections, and availability of resources, including financial capability of the patients and relatives. It is to be noted that it is very, very expensive once one is admitted to a hospital for COVID-19 management. In terms of medical management, remember that everything is done on a no guarantee of recovery. No guarantee of recovery. Best effort basis. The highest mortality rates, when it occurs, this is equivalent to a non-successful medical management. Okay? These are usually seen in those patients with severe and critical stages, those with comorbidities such as concomitant medical diseases, diabetes, hypertension, heart diseases, okay? And those who are elderly. Thus, the moral of the COVID-19 is to avoid COVID-19 infection at all costs, as once you get infected, you always carry a risk of dying from it. Okay? Nobody can predict with 100% degree certainty whether you will recover from the COVID-19 infection or not once you get it. Furthermore, it is very expensive to be hospitalized for COVID-19 management. So take away from this pep talk, COVID-19 patients with moderate, severe, and critical diseases should be managed in a hospital. Compared to home management, hospital management of COVID-19 patients are given more intensive respiratory support, more intensive medications for both the COVID-19 infection and existing medical diseases, and more intensive monitoring of symptoms and vital signs with a lot of diagnostic tests. There are different protocols in the hospital management of COVID-19 patients. In the end, The specific management by each doctor will be dependent on the mindset of the physicians, government approval of the emergency use authorization of drugs against COVID-19, severity of the COVID-19 infections, and availability of resources, including financial capability of the patients and relatives. Everyone or everything is done on a no guarantee of recovery, best effort basis. It is very expensive to be hospitalized for COVID-19 management. So the moral of the COVID-19 is to avoid COVID-19 infection at all costs, as once you get infected, you carry a risk of dying. Nobody can predict with what 100% certainty whether you will recover or not from the COVID-19 once you get it. So this ends my pep talk for this particular topic. Okay. The next thing that we would like to do is to ask, I have invited at least 2 speakers who will share their experiences, okay, when they were confined for COVID-19, okay? But before we call on them, let me remind you to take the OLETE, the online learning evaluation test exercise, and try to get a perfect score and get a certificate. I will give you the link later on. And now, as I said, I have invited 2 speakers. Okay. Where are they? Is Ana Maria there?
Here, Doc.
Okay. Okay.
Hi.
Okay. So, okay. Can you introduce yourself na lang, Ana?
Hi, hello, everybody. Good afternoon po. My name is Ana Pascogin po. Actually, I'm not the one who was hospitalized. It was my husband po. Andito po. Actually, we were both positive, pero he was only the one who has the moderate case. Me is asymptomatic po. This is my husband po, Nides, now recovered from COVID. We will start na po, Doc.
Yeah, sure. Thank you.
Okay, yeah, this is my husband po. So he will tell his experience in the hospital. So ano ko lang po muna, I will just give you background. When the symptoms started. The symptoms started kasi on April 10. So symptoms, he has cough, he has fever, diarrhea, and headache. Sabi niya at first, he thought it was just an ordinary ubo or nilalamig lang daw siya. So sabi ko, sige, let's observe. Tapos parang at first he was in denial na he has ubo. Sabi niya, Makati lang daw yung lalamunan niya. So ako, I was already thinking na it's the symptoms of COVID. Pero siya, in denial na, no, it's not COVID. Wala lang niya, na gininaw lang ako since kasi nasa area po kami ng Tagaytay, Alfonso, malamig yung area. So nilalamig lang daw siya because of the weather. Tapos also sabi ko, let's observe for 2 to 3 days, bumalik na naman, nilamig na naman siya. So sabi ko, hindi na ito normal. So I got a temperature check kasi nagbe-base lang ako sa sinasabi niyang nilalamig siya. So basically, nung check ko siya, he has fever, 39. So medyo na-alarm na ako. Right away, kahit medyo aggressive po kasi yung treatment ko, right away po, nung nalaman ko nag-fever siya, binigyan ko siya ng antibiotic. Azithromycin po. Yeah. So and then I contacted, kasi nakita ko po si Dr. ROJoson sa Facebook. Then I contacted him. Binigyan niya ako ng advice to observe for siguro po for 10 days, nag-home care po kami. And during those days, medyo okay naman yung, we are monitoring his temperature, body temperature, oxygen level, saturation. And yun nga, okay naman. Pero during the 10th day, while we are here at home, nag-fever na naman po siya. So nagpanic na ulit ako. Pero ano lang, during those 10 days po si Dr. Hoso nakamonitor po sa amin. So meron ako mga reports sa kanya na there are days na okay talaga siya, wala siyang nararamdaman, symptoms, although mahina kasi siya. Nakalimutan ko pa palang sinabi. On the 5th day po pala nung start ng symptoms niya, doon kami what do you call this? Swab test. So it turned out positive. So ako, hindi po ako nagpa-swab test because I have no symptoms po. So asymptomatic ako. So basically, pero I assume na baka positive na rin ako. Positive asymptomatic. So anyway, yun nga. So after 10 days, nung nag-fever na siya and bumagsak yung oxygen level niya at 89 to 90, medyo na-alarm na po kami. So yun. Actually, hindi ko na na-contact nun si Dr. Hoso nung nagpapanik na kami na kailangan namin mag-decide to be hospitalized. So, yun. Ikukwento ni husband yung experience niya sa hospital, kung anong treatment yung binigay sa kanya. So anyway, ibigyan ko lang po kayo ng ang diagnosis po sa kanya, ang level ng COVID niya is moderate. Kasi nagkaroon po siya ng pneumonia, 50% of the lungs is infected, and he was given once remdesivir 100 milligram once a day, yung vial niya. So he took it for 10 days. So yun. Yung ano pa yung mga experience, sasabihin ni husband kung ano yung mga na-feel niya yung during nasa hospital siya. Tapos kung ano yung mga treatment na ibinibigay sa kanya.
Hi, good afternoon po. Ako si Nides na asawa niyan. Nung at first na yun nga yung kinukwento niya na ang feeling ko parang wala naman akong COVID. Dahil kasi parang madalas naman ako nagkakaroon ng ubo naman nakaraan. Pero yun lagnat, bihira naman. So nagkataon lang nung sinasabi ko nga sa kanya, nagugas lang ako ng paa na na-expect ko na mayroon water heater, biglang nawala ng water heater. So doon ako lang nilamig. Kaya ang paliwanag niya, sabi niya, hindi ka dapat nilagnat, hindi dahil doon sa malamig yung tubig. Magugulat ka lang na malamig yung tubig pero hindi ka dapat lagnatin. So medyo nag-worry na rin ako. So yun nga, yung in 10 days treatment na nag-ano kami kay Doc, sabi nga, Doc, natatakot ka na ba? Sabi ko parang hindi naman ako natatakot, Doc. Kasi parang yun pala yung parang ako, may feeling lang ako na minsan na inuubo ako. Pag inuubo ako, minsan masakit ulo ko. Inom lang ako ng pang-ubo at sakit sa ulo, parang nagiging okay na ako. So, yun yung minsan na tingin ko nagiging mali ng may mga COVID na sinasabi nila, yung iba in denial nga, na akala nila normal lang yun. Pero sa mga time pala ngayon na dapat, na once na meron kang symptoms or tingin ko medyo mahal lang pero sugalan na natin dahil kasi marami nang namatay dito sa sakit na to. Na ako hanggang sa huli na gusto nilang pa-check pa-swab muna, hindi ako naniniwala sa swab. Sabi ko hindi. So nung sinuwab ako, naging positive ako. So be it, no? Ayun na. Tapos nung sinasabi na kailangan na akong i-hospital dahil in 7 days yata noon parang on and off ang lagnat ko eh. Tapos bumaba pa yung oxygen level ko. So sabi ko, sige, pagbigyan ko pa rin sila. Walang problema. No? Hanggang sa bago pa rin ako ipasok ng hospital, pinipilit ko pa rin sa kanila, hindi nyo ko kailangan i-hospital. Kasi ang lakas ko eh. Kung ano man yung sakit ko na ubot, lagnat, parang simple pa rin to dahil alam ko yung sarili ko. Kung mahina talaga ako, sasabihin ko sa kanila. Pero nangyari pa rin yung hindi mangyari sa akin na ayaw kong pumayag hanggang na ipasok po ako. So ang masakit lang dito, nung in-x-ray po ako, CT scan po ako, ang sinabi nila 50% daw po pala ng ko may damage na. So ganun ho ang mahirap na sa isang tao minsan ina-underestimate mo yung sakit na to hanggang darating ka sa na malala na pala. Na good thing pa rin sa akin na napilit nila ako, lalo ng asawa ko, na talagang ipasok ako, swab ako, dahil kung talagang hindi ko sinunod lahat ng sinasabi nila, malamang dead ball na ako ngayon. Yun po ang ngayon. Doon naman po sa hospital, talagang bored ako dahil yun nga yung sinasabi ko. Feeling ko, ang lakas-lakas ko pa rin. Pero ang minsan na hindi ko lang gusto in normal sa akin ng mga nakaraan, pag nag-i-inhale po ako, hindi ko kayang mag-hold. Yun ang number one na hindi ko kayang gawin. Parang pag nag-inhale ako, hindi ko kayang iganyan kahit na 1 or 2, 3 seconds, hindi, ibubog ako yun. Tapos ang minsan na ayaw ko nangyayari sa akin yung hindi po ako makatulog. Yun yung mga medyo kakaiba sa akin ng mga time na yun. Pero yung pakiramdam, lahat, kaya kong bumuhat, parang yun eh. Tapos in 10 days time, lagi po akong nilalagyan ng remdesivir. Hanggang in 3 days naman po, blood test. In 3 days or 4th day, binaba na po yung oxygen level ko na mas mababa. Hanggang 4th or 5th day po, tinanggalan na ako ng oxygen. Yung the rest po na 5 days, wala na po akong nun. Tapos, puro vitamins po yung inaano nila sa akin doon.
Puro monitoring ng inflammatory.
Ayun, monitoring po ng inflammatory. Tapos meron po ako nung 3rd day po na inanila ako ng remdesivir. Sabi nung doktor ko, in the 4th day, naubos ko na yung remdesivir na binili ko, meron po silang sinabi sa akin yung tocilizumab. Yun po, medyo mahal po yun dahil nung tinanong ko po dun sa hospital na yun, yung remdesivir nasa 8,000 plus po. Yung toci po na tinatawag nila parang nasa 30,000. So nagkataon po, meron kaming kakilalang doktor na kinausap po yung doktor namin. Meron po siyang tinatanong yung doktor namin na kung itinest na ako nung blood test na ganitong tawag. Sinabi po nung doktor ko doon sa Kalamba na wala daw po silang ganong test. Yung test daw po na yung kung gusto namin ituloy, kukunan po ako ng blood sample, dadalhin po sa Makati Med. So yun po ang ginawa ng asawa ko. So nalaman po namin kinabukasan, normal naman po, yun ang sinasabi na hindi dapat po ako saksakan ng tosi na yun. Pero ang katwiran po ng doktor namin doon, medyo aggressive sila, no? Na kahit hindi pa kailangan, inaagad na nila dahil kasi ang reaction po ng COVID medyo mabilis nga daw. Baka mamaya it's too late na dapat inano na yung tosi na yun. So yung 4th day naman po na yun, lumabas din yung kinancel din naman po ng doktor namin dahil yung isang test ko po na ginawa nila, gumanda naman daw po yung findings nung nung baga ko. Yun yung parang naging nila. Kaya ang ginawa po nun, tinuloy po ako ng remdesivir for another 6 days. Kaya in total po ng 10 days naka-remdesivir lang po ako and vitamins. So ayun po, medyo buti pinayagan po ako after 10 days nang bago ko umuwi, parang in-stress test nila ako na mag-walking daw ako in 5 minutes at titingnan nila yung oxygen level ko. Since nakikita ko naman nung mga time na yun na kahit may oxygen ako noon, hindi na ako nag-oxygen Dahil hindi ko, parang naiilang pa ako So yun, nung tinest po ako, nag-decide na rin po yung doktor ko na parang okay na. Na para ma-discharge po ako. Ayun.
Okay. Thank you. Thank you, Nides, saka Ana. Okay, thank you for sharing. No? So
Yes,
at least, I think topic today is just on hospital management. Somehow you covered the topic that I talked on last week. No? That was home management.
Home management.
No, kasama na rin ang ginawa ko sa inyo. Home management, and then after that, you go for the hospital management when indicated. No? So yung kay Anides, naging moderate siya, di ba? Moderate, kaya kailangan i-admit na siya. No? And all of you have noticed that, as mentioned by Nides, yung mga presyo ng mga remdesivir, tocilizumab, etc. at mga aming test, mahal talaga yon, no? Okay. So thank you for sharing, ha? Para it will reinforce what I'm trying to talk about in this particular pep talk, no? I just give the principles, no? But I will just reinforce with some actual experience from some patients, no? Thank you, Nides, saka Ana again. Okay. So just stay there. Baka may mga tanong mamaya yung mga participants natin, no? Okay. Okay, can we, for the next speaker, I think I saw Miles. Miles, are you there, Miles?
Ako po, andito po ako.
Okay, can you share your experience?
Ako. I am Miles Ocampo, a 71-year-old childless widow. Kasama ko sa bahay ang pamangkin ko at ang misis niya. Simula po nung last year, nung magkaroon ng COVID, hindi ako bihirang-bihira ako lumabas ng bahay. Yung mga pamangkin ko naman, lumalabas lang sila pag may kailangan bilhin. At alam ko, pinapractice nila yung safety protocols. Kaya nagulat kami, tatlo kami na nagpa-swab test kami, puro kami positive sa coronavirus. Unfortunately, meron akong comorbidities. Isa po akong asthmatic, may enlargement of the heart, also a pre-diabetic. At saka dahil ako nga yung pinakamatanda, ako yung pinakagrabe na hit ng COVID-19. Yung una ko pong symptom ay slight fever. I took biogesic every 4 hours. Tapos kinabukasan, wala na yung fever. Kaya lang, nauwi sa ubo at saka para akong aatakihin ng hika. Sabi ko naman, usual sa akin yun na minsan nauuna ang lagnat tapos natutuloy sa hika. Pero parang naisip ko na yun din ang symptoms ng COVID. Kaya yun nga at saka yung time na yun yung cases tumataas. Kaya I decided to have a swab test. Tapos yun nga, ang malungkot na balita, I was positive to COVID-19. Kaya immediately, I called my doctor and informed him of the outcome of my swab test. Binigyan niya ako ng mga medicines na iti-take, tsaka he gave me instruction to monitor my blood pressure, temperature, and oxygen saturation every 3 hours na nire-report ko sa kanya via messenger. Ang pamangkin ko, nakahiram siya ng oxygen concentrator, pero kahit na nakakabit ako doon, yung oxygen level ko hindi maabot ng 90. Kaya yun yung parating, nung huling araw bago ako ma-confine, nasa 80 lang siya, 80 to 85. That was the time that my doctor told me to have myself taken to a hospital. Pero yun yung time na peak ang COVID cases. That was April 15. So it was really difficult to be admitted in a hospital. Pero buti natulungan ako na isang close friend ko, na-confine ako sa isang government hospital. Doon sa government hospital na yun, walang private rooms, puro wards lang. Ang nangyari pa, nagkaroon ng miscommunication doon sa admission ko, kaya I had to wait for 4 hours before I was finally admitted. Mabuti na lang, binigyan nila ako ng oxygen habang naghihintay ako. Tapos kinuha na rin ang chest x-ray ko, ECG, tsaka blood test. Alam ko naman na ang COVID patients hindi allowed na magkaroon ng kasama sa kwarto. Pero hindi ko alam na doon sa ospital na yon, ang pasyente, kanya-kanyang dala ng gown niya, ng unan, ng bedsheet, eating utensils, plates, baso, drinking water, and electric fan. Pagpasok ko sa ward, kung saan ako ay ika-4 na pasyente, 4 lang naman kami sa ward. Kinuha na agad yung aking oxygen. Nasa 79 lang ang aking oxygen saturation. So the nurse gave me an oxygen mask, which was hooked to the oxygen tank at a constant flow of 10 liters per minute. Yun yata yung pinaka-maximum. An IV line was inserted for hydration and IV medications. I was instructed to lie flat in bed. Kaya yung sa first day ko, kahit na naka-feel ako ng relief dahil sa oxygen, hindi ako makatulog. So many things were bothering my mind. Takot ako kung anong mangyayari sa akin. Nalulungkot ako kasi hindi naman ako sanay na mag-isa. Tapos may anxiety ako. Tapos I was still in denial kasi parang ayaw ko pa sanang pumasok sa ospital. Tapos init ako dahil wala ang aking electric fan, nadala lang the next day. So yung first day ko very unpleasant. The next day, nagpapaalis na ako tinawagan ko na yung pamangkin ko. Sabi ko, alisin mo na ako dito sa hospital. Gusto ko na umuwi. Willing ako mag-execute ng waiver. Sabi ko, baka mas magkasakit pa ako dito. Pero sinabi niya, ang hospital may round-the-clock monitoring. Ang oxygen delivery mas malakas kaysa sa oxygen concentrator natin sa bahay. Tsaka wag akong mag-give up at once. So, nag-stay naman ako. Nag-agree ako sa kanya. On my second day, I was given remdesivir through the IV. Tapos marami na ring gamot. Hindi ko alam kung ano-anong gamot yung nanilagay sa IV. There were also oral medicines given. Daily, the nurses would monitor our sugar level. Twice a day, they would take our blood pressure, temperature, and oxygen level. For 6 consecutive days, blood was extracted to determine the arterial blood gas. During the first week, my oxygen saturation level fluctuated from 82 to 93. Gradually, the pressure of oxygen was decreased to 8 liters per minute. As days passed, I became adjusted to the hospital routine. Naging parang gumaang na yung loob ko, naging kaibigan ko na yung mga kasama ko sa kwarto. Pero among the 4 of us, I think that I had the most severe case because I was the only one whose oxygen was always at the maximum pressure. In the second week, binawasan na nila yung binawasan na nila yung oxygen pressure. Unti-unti na kasi nakita nila kaya ko nang huminga. Tapos yung dating oxygen mask pinalitan na ng nasal cannula. At nakikita ko na kaya ko nang huminga kahit medyo matagal na wala yung nasal cannula. On my 11th day, they took a repeat chest x-ray and several blood tests. By the end of the second week, the doctor told me that I would be discharged. One thing that I'm so thankful for is that upon my discharge, I did not pay anything. The cost of oxygen, x-ray, ECG, and all the laboratory tests were offset by PhilHealth and my senior discount. Pero dun sa hospital na yun po, ang mga gamot, ang pasyente ang bumibili, ang bantay ng pasyente, kung sino yung relative ng pasyente na available. Sa case ko, ang nagbayad yung pamangkin ko, ang sabi niya mga about 100,000 din yung nagasta niya. So on my 15th day, I was back home, very much grateful to the Lord Almighty for allowing me to survive the perils of the deadly COVID-19 and for allowing me to live and enjoy life once more.
Okay. Thank you, Miles. Thank you for sharing. No? So in the government hospital, you were able to spend 100,000 approximate. No? Okay. So, but yours is still in the mild, moderate stage. No? Yung mga naka-ICU na, then those who will stay there for about 1 month, no? I have heard of stories umaabot sila 1 million, 30 million, no? Especially sa private hospital. Okay. So that's why I said it's very, very expensive to be managed in the hospital. Okay. Okay, thank you, Miles. Now, you have heard the two narrations of experiences, and then you also have heard the basic principles that I presented on hospital management. No? We will now open the, what do you call that? The floor for any questions and answer for Q&A. Okay. Any questions that you want to ask, you can raise your hands by using the reactions button, or you can unmute yourself right away and then just ask the questions. Elsa, may mga questions ba? No questions? I didn't see any questions posted in the chat box. Do you have any questions?
There is nothing posted in the chat box.
Okay, so do you have any particular questions that you want to ask? O baka yung mga iba dyan, meron din you have the same experience being hospitalized. Would you like to share? We still have about 20 minutes. Anything to share? Okay. Gabriel, you want to share, Gabriel? Gabriel, you want to share your experience with your family?
Ay, sorry, nakamute pala po.
Okay.
Hi. So po, yeah, yung, ano ka lang po, quick thank you lang po dun sa nag-share. Lalo na po si Miss Miles. Very nakarelate po ako dun sa experience ko naman po with my mom. Ayun, although yung mom ko not as happy ending with Miss Miles, so, pero really happy po na there are patients na nakaka-recover from COVID at yung mga factors na like yung age and their comorbidities na kaya nilang laban. Thank you po and kay Miss Hannah sa pag-share kanina. And then yung sa akin naman po, I was also hospitalized. So I got COVID from my mom kasi ako po yung nagbabantay sa mom ko sa hospital. And hindi siya na-confine. Taga San Juan po kasi kami, San Juan, Metro Manila. And meron yung San Juan Hospital na parang holding area, mga container van of COVID patients na barely monitored. Pero sila yung parang wait list to be admitted sa main hospital. So we were inside the hospital but not really admitted. So first case namin, yung mama ko na ng COVID. So we didn't know about yung remdesivir. Hindi rin kami inoffera ng doctor. Actually wala kami na-meet na doctor. Mga nurses lang that monitored yung vitals, tinataasan yung sa oxygen lang, nire-refill yung IV, and then nagbibigay ng antibiotics prescribed. Pero wala kaming walang nagsabi sa amin na ito na yung case ni mama. We didn't even know na critical na siya at that time. So April 17, my mom passed. And then April 18, nakauwi na kami sa bahay, nag-home quarantine kami kasi we were all, me, my sister, and my tita with my mom's sister. we're all exposed sa hospital. Kanya kami private bathroom. Ano, parang nagluksa kami April 18. And then April 19, I had a fever already. Sabi ko, eto na. Nag-start na. Because I was really, although naka-PPE ako whenever I go inside yung container van, I was with 8 other COVID positive patients, including my mom. So parang sabi ko, sure na ako. Sure na ako magkaka-COVID ako because I'm not vaccinated, although I take vitamins. Parang malaking risk na, or malaking possibility that I would have COVID. So after second or third day of fever, nagpa-swab test ako pero negative pa at the time, and nagpa-x-ray din ako with my tita and CPC. Everything was normal. Yung lungs ko were also clear at the time, third day of symptoms. And I didn't develop any other symptoms except fever. Wala akong ubo, hindi rin ako sinisipon. So talagang fever lang. And when I would monitor my oxygen levels, hindi naman siya bumaba ng 95. So I would just, siguro mga 5th or 6th day, kahit nagta-Tylenol na ako, hindi talaga bumababa yung fever. On siya every day since April 19. And then, napansin ko on the 5th or 6th day of symptoms, pag nagdi-deep breath ako, naho-hold ko naman yung breath ko, pero parang makating lalabunan. And then, yun nga, parang sabi nung husband ko, ni Miss Ana, na parang nauubo siya or nare-release agad yung hangin sa lungs niya. Parang hindi niya kayang i-hold ng matagal. So, I felt that as well. And then, nag-urge na nga kami, naghahanap na kami ng pwedeng mapasukan na hospital kasi we don't want to have a repeat of what happened with my mom. Although hindi pa namin sure kung eto na ba, kung positive na ba ako kasi last test was negative. And buti na lang meron kaming family friend na parang sabi, dito kami naka-confine and kapag pag na-discharge na kami, baka pwede naming kayong ipasok. But this was in Pampanga. So malayo yung hospital. So luckily, we drove there, kami ng tita ko. We drove there siguro mga 2 hours lang from the day na sinabing discharge na yung family friend namin. Pwede na kaming i-admit. We went there agad, and nung una, hindi pa kami swab test. CPC, X-ray, and ECG lang muna. Luckily, kahit wala pa kaming positive result, in-admit na kami. Tapos, that same night, nung nasa thankfully private room naman siya, kaming dalawa lang ng tita ko sa isang room, one bathroom for the both of us. Parang dumating yung doctor, sabi, ihaputi na yung baga mo. And I didn't even know kasi yung oxygen level ko kahit nung we arrived at the hospital, hindi naman bumaba ng 95. Not sure kung anong percentage of yung hit sa lungs ko, pero sabi niya parang lower right was white na. So agad 2 doses ako of remdesivir that night already. And yung price nga sa Pampanga, 10,000 I think per vial. And then sa San Juan, nung sa mom ko, although we didn't ask for remdesivir kasi hindi kami aware and optional daw sa nila. Sa San Juan, 20,000 per vial. So grabe ang presyuhan ng gamot. Yun, me and my tita got tested the following day, yung swab test po. And then medyo na-delay pa kasi nasira daw yung system. Dinala pa from Pampanga to Mandaluyong. Third day po, ko nalaman na positive ako, and my tita luckily was negative. So siya, na-discharge na. And ako, I had to stay there for a total of 6 days. Remdesivir po ako for 5 doses yung binigay sa akin. So sabi kasi nila, once you start with remdesivir, ang explanation sa akin is dapat 5, 7, or 10 doses. Hindi ka pwedeng magkulang doon sa ganun. So luckily, after 5 doses, in-x-ray ako ulit, and then almost all clear na daw po at that time. Marami rin pong oral medication din na binigay, at saka antibiotics, antiviral, at saka mga vitamin. So, ang routine ko lang sa hospital, yun, malungkot from what happened with my mom. Tapos ngayon, ako naman yung may sakit, so physical and emotional stress. Pero yun, nag-Netflix na lang, magpapalibang, gano'n. And then, luckily, I was discharged after 6 days sa hospital and moderate yung nasa medical certificate ko and may coverage naman sa PhilHealth. Although not fully covered, meron naman akong company HMO. So, yun, wala po akong binayaran from combination of PhilHealth and HMO. Pero, inabot din po kami ng ako 250,000 for 6 days only. Yun. And then when I got home, wala na po akong fever. Pero, like ngayon, pag matagal nagsasalita, medyo parang hingal pa din or yung activities that I used to do, konting galaw ko lang parang hingal na. And then, yun nga, my other titas po, yung other siblings ni mama, sabi niya, pag nagkaroon kayo ng other symptoms or ano, dun kami na-introduce sa PGH Telegabay where I met Dr. Joson po. Kasi after being discharged from the hospital, they said 10-day isolation pa ako sa bahay, which I did that. And then after the 10-day isolation, siguro 1 or 2 days after, nagka-fever ulit ako one time. And then so nagpanic na naman ako, parang ba't ako nagka-fever ulit? Hindi pa naman ako lumalabas ng bahay. May COVID pa ulit ako. So yan, we reached out to Telegabay and had a call with Dr. Joson, and parang so we had yung session where he collected all of yung mga medical history, and so we decided to yung monitor and give updates on temperature and oxygen every day. And then 2 days after, nagka-rashes naman ako. Initially sa arms and then nag-spread siya hanggang leg. So nagpa-check din naman po ako CBC and for dengue. So not na ano naman po siya, negative for dengue, and normal pa rin naman po yung sa CBC ko. So after 14 days ngayon, wala na masyado yung rashes ko, although I still give Dr. Joson updates sa condition ko. Yun yung story ko from until now. Medyo stressful, pero I'm happy na kahit papaano, like yun, nakasurvive ng COVID. I didn't know moderate na yung case ko. Akala ko kapag natamaan akong COVID, kasi I'm only 28, feeling ko na baka asymptomatic lang ako or mild na kaya kong i-home quarantine. Tsaka sabi ko, fever lang naman. Yung una, parang ayoko nang ma-hassle sa hospitalization, pero I thought nga na kung andito na yung opportunity na ma-admit, magpapa-admit na ako. So, nung nagkaroon, good call pala kasi tama na yung lungs ko, tapos moderate case na. So, sabi nga dun sa slide kanina ni Doc, pag moderate, may possibility na dapat ma-hospitalize. Hindi na siya kaya i-manage at home. So, yun. So,
okay. Thank you. Thank you again.
There are questions here in the chat